Hi, everybody. Happy Wednesday. This is Dr. Madiha Saeed, board certified integrative holistic family physician, coming to you guys live from my home in Naperville, Illinois. So I hope you guys are doing well. And I wanted to come on for a couple minutes and talk about, sort of offer myself to you to ask for questions, because I know this is a confusing journey and it's really nice to have somebody on your team that can explain it to you a little bit more clearly and cost effectively and efficiently, and who's very passionate about the subject, and on top of that, who practices what they preach, right? So it is really, really important to focus on you. Okay, and this is where we're going to talk about. So let's go ahead and recap. If you guys have any questions, please feel free to give me questions. Say hi to me until at least one of the kids walks in. Say hi. I want to know where you guys are from. Like and share this video so we can spread this message of hope and healing to the world. Yay! So again, if you guys have questions, please feel free to ask me anything today, right? So let's talk about what the approach to healing. We have multiple chronic conditions, starting from our head all the way down to our toes and everything in between can become inflamed. Inflammation is when your body is off balance. And there's two different types of inflammation. There's acute and chronic. Acute is basically when it's this fiery response that occurs when you have an injury, and if you're trying to protect off like infections or heal chronic illness or heal disease, or with something really fast and easy, right? Because that's like fast, easy, not really maybe easy, but the thing is it's fast and it helps to heal, right? And that's good inflammation. Then there's another type of inflammation that's called chronic inflammation, and that's a hidden smoldering fire that can destroy this beautiful masterpiece that we were born with. And these are all symptoms of chronic illnesses. Conventional medicine goes and treats each one of these separately, but if you look at the root cause in the chronic inflammation, and if you are able to fix those deficiencies that can lead to chronic inflammation, not one symptom disappears, but all of them disappear simultaneously. It's really exciting. Natasha, hi Leanna. Natasha, thank you for your question, Natasha. L-glutamine and healing the gut, what are your thoughts? So healing the gut is really, really important, right? Because your 70 to 80% of your immune system lies in your gut. We also call it the gateway to your health because of the 70 to 80% immune system, because of 100 trillion bacteria that line your gut lining, all really, really, really key in determining how our insides and our outsides function, right? And if somebody does have chronic illness, healing the gut is really, really important in that step. There are other aspects of it like social, spiritual, mental, emotional, and physical, digestive health is a big key piece. Whenever I target the gut, I focus on the 5R program, but I keep it a little bit more simpler. I focus on real foods. So for the first one is to remove those foods that act like the gasoline to the fire that's going on inside. I have people remove dairy, gluten / grains, sugar, processed foods, soy, starchy vegetables, and then other food sensitivities that you may have individually. Then I have them replace good healing foods like tons of vegetables, healthy protein, clean protein and healthy fats, hydration with water. Then we repopulate with probiotics. That is one of the supplements that I do recommend. I'm not a big supplement person, but that is one that I recommend. Probiotics and prebiotics, which is that food for the probiotics. And then we have is to repair that gut lining. And this is where L-glutamine is really important for repair. But again, because I'm cost effective and time effective and not everybody can do L-glutamine, sometimes it's really easy to do bone broth. And bone broth is full of amino acids and bioavailable minerals and vitamins that can help to repair that gut lining. L-glutamine, proline, lysine, all of these amazing amino acids that help to repair the gut lining are found in bone broth. And that's something you're going to throw away anyway, so it's better just to use that, stick it in a crock pot with some vegetables and parts and herbs, and then just let it simmer all day long in the crock pot. When you come back, it's like, oh, it's awesome, the healing bone broth is ready. And that contains a lot of L-glutamine, which is necessary to help heal your gut flora. So I hope that helps to answer some of your question. And then there are other gut healing supplements, but in 7 years, I haven't really had to use that much at all. Really, a lot of people are doing really well with just the 5R steps, the simple, easy steps that are really, really simple and easy, right? I know I can't say that enough because it's really exciting stuff. So we talked about removing, replacing, repopulating, repairing, and then rebalancing. And the rebalancing, this is where the gratitude comes into play. So your social health, how are you sleeping? Your stress, how are you managing your stress? Your detoxification, detoxins, your insulin resistance, all of those make a really, really important piece of healing the gut flora. But just like our foods are becoming deficient, our bodies are also deficient of nutrients and minerals. Why is that? Our diet is now full of processed foods. It has low microbial diversity. We are becoming the commercial indica. The commercial is really, really all the stuff that's going on commercially, the stuff that we put in the soil, toxins in our environment, an increase in inflammation, the medications that we're taking, all of those are leading to nutritional deficiencies. And nutritional deficiencies can delay your ability to heal. So I'm not a big supplement person. And if I do supplements, I only do the very basic key supplements initially. And then depending on your individual situation, I will then add on and layer them in depending on what your individual needs may be. Because, for example, depending on because that then depends on how do you know what your individual needs may be, right? So first, especially the history is really important to find out exactly what kind of things that you could be exposed to, what kind of medications are you on? Because there are a lot of medications that can cause problems. For example, we have proton pump inhibitors, can cause depletions in beneficial flora, calcium, digestive enzymes, folic acid, B12, biotin, chromium, the list goes on and on. Anti-anxiety drugs can diminish melatonin. Antidepressants like SSRIs can diminish iodine, selenium, and folate. Oral contraceptive pills can diminish vitamin B2, 5, 6, folate, B12. Then we have is magnesium, zinc. The albuterol inhalers can diminish magnesium and potassium. We have anti-diabetic drugs, can diminish coenzyme Q10, vitamin B12, metformin. There are, so many. Aspirin diminishes B1, biotin, folate, C, iron, and zinc. Do you get the picture? The picture is that these medications, depending on your individual needs, depends on what exactly you're taking and your specific history. So I only supplement those absolutely necessary ones. But first, how do we choose a supplement, right? The way that we choose a supplement is to make sure that, because I want to really enforce the fact that the supplement industry is largely unregulated, and that we want to make sure to look for the label, the USF, or we have, USP, GMP, or NSF, and to make sure that the supplement that you are taking doesn't contain any additives or food sensitivities or anything like that that could cause problems, right? And so your best bet is to buy off of your functional practitioner that they trust. So I would ask your functional integrative physician, because again, everybody is different. And again, another thing that they're really, really important is it's really helpful to go to a nutritional store, and that nutritional store will then I have a guest. So that nutritional store will have some of those supplements for you. So what are the supplements that I recommend? And those supplements are your vitamin D. So we have your vitamin D, right? And vitamin D is actually more of a hormone, or a pre-hormone, than it is a vitamin, right? And vitamin D is produced by sunlight. And when this happens, the liver transforms the vitamin D into the more active form, and it allows our cells to read DNA instructions more effectively. It's really important in genetic code. It helps with neurotransmitter. It fights cancers. It is essential nutrient. It helps with absorption and transport of calcium, magnesium, phosphorus for bone mineralization and growth. It's a disease preventer, and it lowers inflammation. It even lowers insulin resistance. So that's one of the key ones that I look for. Yes. What are you looking for? That's the key ones that I look for once for all patients. And I'll do that through an individualized testing. So because most of us are deficient in vitamin D. So it's really important to start taking after you get your blood level checked by a practitioner. I want this level between 50 to 100, 50 to 80. And stuff all over your face. Crazy ones. So we have 150 to 100, 50 to 80, 50 to 100. And depending on your situation and individual condition. So, thank you. I love you too. So, but the thing is, you can get that. Come, buddy. We don't want to stop that. You can get that through the sunlight, but it's really, really difficult too. So it's better to go ahead and get that through your supplementation. And again, everybody is a little bit different on how much they actually need to take. You can take this, make sure to take D3, that's the best that's absorbed. And then otherwise you can take a vitamin D, a cod liver oil. Cod liver oil, sorry you guys, my husband had to get out. So cod liver oil has your A's, your D's, and a lesser extent your K's and E's, vitamin K and vitamin E. Fermented cod liver oil is a little bit stronger, so I take half the dose. And that is, some people can tolerate the cod liver oil a little bit better. Then we have vitamin K2. So when you start supplementing with vitamin D, it's really important to also start supplementing with vitamin K2. Now, there's two different types of vitamin K, and the one that we're talking about is, you probably hear more often, is called vitamin K1. And vitamin K1 is really important in blood clotting. It's found in vegetables like lettuce, broccoli, and spinach. But then the one that we're talking about here is called vitamin K2. And it's for cardiovascular health and heart and cancers, and it gives you strong bones. Because what vitamin K2 does is it tells the calcium where it needs to go. Thank you, Cindy. Thank you guys for the heart love. And so the vitamin K2 tells the calcium where it needs to go, right? So that's really important, because otherwise what happens is it'll end up going out of your bones into your heart, your arteries. And so that's really important to make sure that you're taking enough vitamin K2. Now, you can get that in nutritional foods. So the foods that you have that have lots of vitamin K2 are your fermented foods, right? Because those bacteria, the fermented, that vitamin K2 is produced by your bacteria. So the fermenting food, like source is great. And again, it tells the calcium where it needs to go. And again, we should be taking it whenever we take vitamin D. And a dose about 100 to 250 micrograms is usually good, again, depending on your needs. Again, you should never mix vitamin K1 with warfarin. So that's something that we're really cautious about. The next thing is we have magnesium, right? 75% of the population is deficient in magnesium. And magnesium is really important for your nerve cells, your muscles, your bones, and it plays a large role in immunity. Qasim? No, we don't want to draw on the walls. No, oh, you're drawing on paper? Thank you. So, our cells need magnesium in order to work effectively. For all of the enzymes, for detoxification, for methylation, it helps in ATP and DNA and RNA. It helps in muscle contraction. It helps build like production of testosterone and progesterone, production and utilization of fat and protein and carbohydrates, metabolism of calcium, sodium and potassium, and it also is a main constituent in your bones and teeth. It actually can help to reduce the spasticity in your muscles and improves chronic pain, lowers blood pressure, increases HDL, lowers triglycerides, improves hsCRP, which are all inflammatory markers, and improves blood sugar levels. So it has such amazing benefits. And we really need it. And because 75% of the population is deficient, this is one that I do supplement, again, depending on each situation. And I start off with about 400 milligrams per day, and then go, depending on what their labs are, if they're really deficient, then I will increase it for like about 3 weeks and then go from there. And which one, there are multiple varieties of magnesium, and glycinate is a really good one, that and malate are really well absorbed. If you have constipation, magnesium citrate for a short time is really good. It helps you calm down and helps you eliminate. So that's really cool. And now food sources of magnesium include dark chocolate, yay! Avocados, greens, cashews, almonds, pumpkins, salmon, all those fun stuff. Let's get to some questions before I get on. You want to help me with some questions? No? Okay. So we had some questions here. Thank you, Cindy. Melissa, oh, so patient. Again, this is my passion and trying to spread this message. So it must be I've healed my gut, so it allows me to give me some patience. And then we have Marlene. Thank you. I take 10,000 units of vitamin D and K2. Now that the levels are up, how much should I take? Started at 19 and now at 55. Have Hashimoto's. So vitamin D is really important for anybody with autoimmunity. And they say vitamin D deficiencies can actually contribute to multiple autoimmunities. So it's really important to keep your vitamin D level up. And I would, depending on your current situation, I usually recommend starting patients off 20 times your weight in pounds of vitamin D. And that's like the maintenance dose to continue. So I hope that helps. And anything for teen acne, yes. So acne, again, what is it? Like it's inflammation, right? And so healing the microbiome, focusing on all those factors of inflammation is really important, right? But what's really important in teen acne is to manage insulin resistance. And insulin resistance is, we talked about in the last couple of videos, how insulin resistance is when your body, so what we did, for glucose, our cells need glucose for energy. But the only way the glucose can enter the cells if our pancreas releases something called insulin. Insulin goes and knocks on the cell wall and lets the glucose in. But what happens is that over time, especially with the foods that we eat, chronic stress levels, like the processed foods and medications, there's a lot of different factors that keep the glucose elevated all the time. And when the glucose is elevated all the time, what happens is that your insulin level is elevated. But your cells, because the insulin level is elevated all the time, your cells stop responding to the insulin. And when they stop responding to the insulin, that is a state called insulin resistance. And that insulin resistance causes symptoms of fatigue and irritability and acne and migraines and sugar crashes in the middle of the day, carb cravings, weight gain around the midsection that doesn't go away. So there are a lot of things that insulin resistance can cause, and specifically it can start to affect us girls and immediately with our abnormal periods and acne. And so this is where focusing on that insulin resistance is really important to help teen acne. And how are we going to help insulin resistance? The best way to do that is to focus on your vegetables, your protein, and your healthy fats. All of those will stabilize your insulin and also improve gut dysbiosis, or the inflammation going on in your gut, to lower all overinflammation, to lower insulin resistance, to help with overall inflammation. So it's exciting stuff that will help. So again, if anybody else has any questions, let me know. Otherwise, my child will just continue writing. What are you doing? Oh, you want to see his beautiful artwork? Why are you writing on your fingers? You don't want to write that. So what about zinc for teen acne? It's a boy. Yes. So this is where zinc is really beneficial. There are a lot of supplements for, again, making sure specifically for acne. You want to, and all of these chronic conditions, probiotics, fish oil, magnesium, vitamin D, and zinc. If we can do bone broth also has some bioavailable zinc in it. So that's also really important too. So if you can get it through foods, that is my first priority, is to get it through foods, but it really helps out overall too. So that would help. And fish oil. We talked about fish oil. Fish oil is a natural anti-inflammatory, and it is rich in omega-3s and omega-6s. We need it for our cell membranes to work properly, and it's beneficial for so many medical conditions. So this is, again, another one of those that I do recommend to patients. And because what happens is that, especially when through our foods, our vitamin fish oil, we can get specifically through our foods. But how many of us actually eat a lot of fish regularly? Not many. Our brains are made out of 60% DHA. And so we need DHA and EPA for our cells, for basically every function of the body. And it improves skin and nails and hair and prevents and heals chronic disease by lowering inflammation, improves fertility, and it helps in cancer. So there's so many things that it can really, really benefit. But because we're not getting it from our diet, and the processed foods usually contain pro-inflammatory fats. So if we're not getting the anti-inflammatory fats and we're getting the pro-inflammatory hydrogenated oils in our diet, what happens is that we then take this in, the pro-inflammatory fats we take in. And where does that deposit? In our brains. And when that deposits specifically in our brains, we have depression and anxiety and all of these chronic conditions. So it is really, really vital for anybody suffering from any chronic illness, talking to your doctor first, obviously, but to supplement with, at least supplement with, but you don't want to do that? No. They're always doing something. So to supplement with vitamin D, fish oil, that's what I was talking about. He distracts me a little bit. So fish oil or cod liver omega-3s can be found in cold water fatty fish like sardines, herring, trout, wild caught salmon. Grass-fed beef actually has fewer omega-6s, and this is where you really want to make sure you have balance of omega-6s to omega-3s, because if we have too much omega-6s compared to omega-3s, that can also cause inflammation. So I recommend my patients being on at least 1 to 2 grams of EPA and DHA, right? And remember, everybody is different, so if you're on blood thinners, you really want to talk to your doctor first, because there's a small chance that it can cause some platelet inhibition, but I haven't seen it in 7 years. But again, these are all things that you want to discuss with your doctor about, because again, they're natural ways to help improve and speed up your recovery, right? So we talked about these 4 specific things: your vitamin D, your magnesium, your vitamin K2, fish oil, now probiotics. Probiotics is another one that I recommend most patients. Again, because of the fact that our gut is 70 to 80% of our immune system, and we have 100 trillion bacteria, and over time, these foods can start to kill off these bacteria. When these foods start to kill off these bacteria, we start to get sick. And we want to add in those good bacteria to help create that symbiotic relationship. And you want to look for, if you are going to take a probiotic, and again, sauerkraut is really good for those, for select patients, but what's really important is we want to focus on the more strains. The more strains, the better, right? And so the more strains, the better. You have, especially if you're dealing with a yeast issue, it's nice to have your Saccharomyces boulardii. If you are so again, the more strains, the better. If you have, extra bonus and plus point, if you have some soil bacteria like Bacillus coagulans or Bacillus subtilis, is really important for the gut bacteria, and it helps create more. Actually, it helps to increase your lactobacillus. Oh, Marlene says thank you. Thank you. My pleasure. It is my honor to serve you guys. And okay. And I know we gotta wash your. So these are the supplements that I recommend most patients. Now there are, depending on your situation, there are some supplements that you can also take for, like, the most common if you have pain issues. Turmeric, adding turmeric is it's an awesome anti-inflammatory. If you have arnica, is a homeopathic that I recommend most patients. If you have sinus issues, there's Sinasalia allergy that I add. It's a homeopathic. You can find it at Walgreens. There's no side effects, no drug interactions. If you have allergies, there's Sabadell allergy. If you have problems with flu or cold type symptoms, there's cold calm, or there's oxylococcinum. Again, these are homeopathics. I really like to go to homeopathics because there's no side effects, there's no drug interactions, and it really works with a lot of, it really works really well with a lot of patients. If you can't sleep, Quietude, Calm Magnesium are my go-tos. So, I mean, those are like the biggest ones that I recommend. Now, if you have after doing labs, like after I see you the first time, I usually give you a set of labs. And those set of labs, I will then be able to determine to see if you guys have any further deficiencies. For example, the magnesium, the vitamin D, and B12. Another one is that if you have elevated homocysteine levels. If you have elevated homocysteine levels, I like to supplement with folate and B6 and B12. So that helps to optimize detoxification, bring down that homocysteine level, and lower inflammation, overall inflammation. If you have a detoxification issue, there's a lot of toxins in your home, starting something like a glutathione or an NAC, L-acetylcysteine, milk thistle, liver enzymes to help really get rid of that. Again, I don't use a lot of these all the time. It's just individual need. The basics are your fish oil, probiotics, magnesium, and vitamin D, then adding condition specific. So now my book, I'm really, really honored that my book, The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease, out next month. Yay! Party! All right, Goslin, can you party? Party! It's like, no, I'm done, Mom. And so a lot of so I'm really excited. So what I've done in my book is I've split it up into 2 sections. And the first section is the foundations of good health, all this digestive, chronic inflammation and disease, digestive health and detoxification, the 4 S's, stress, sleep, social, and spirituality, because that's really where I like to focus on. And again, all of these extra supplements and all integrative modalities are all adjuncts to the foundations of good health and your conventional treatments. So this is where I want you to focus on your life foundations of good health. Add in supplements whenever necessary, just because there are a lot of deficiencies, because of all the toxins, our food, and the way that just overall agriculture. If you guys have any other questions for me and Liana, ask rotating probiotics necessary and how many different ones should be in a month. Not necessarily. Adding in probiotics, you're getting a lot of the best way to add biodiversity is to really get outside, play in the dirt. Dirt is your friend. And that too, especially like the organic type, and to go in, because our guts we have trillions of different types of species. We have tons of different species, trillions of bacteria. And so the best way to increase that biodiversity is to get out, get in touch with nature, and then go from there. So it's really exciting stuff. Again, I'll be able to answer any questions. Just feel free to keep on asking questions, because I am always here for you on this journey towards wellness, so you can be your very best you. Have a great night, you guys, and I think I'll probably talk to you tomorrow if it's not crazy busy. And if you have any questions, I'm here for you. Mwah. Have a great Wednesday. See you Thursday. Bye, you guys.